This video is a basic illustration on how I do a pupillary cerclage. So here you have a dilated pupil. What you'll need is a double-armed tenoproline on a CIF4 needle. There are alternatives, but this is how I do this technique. So the end goal is to be able to thread the tenoproline 360 degrees around the pupil, and then to have the two needles emerge through the same incision, cut the two needles, and then tie the suture down. That way it enters into the anterior chamber, and then you'll be able to complete the procedure. So first things first, this is how I start. So I'll leave one needle away from the eye. I'm going to direct this needle from making 4 paracenteses. I'm going to start at this paracentesis and then catch the iris close to the pupillary border as much as possible. And I'm going to exit out through this paracentesis. And so with this method here, you're going to have to hold the needle with the left hand. And so here you can see that the needle has emerged out through this paracentesis. Again, you can leave this guy alone for now. Next, we're going to take this needle, bring it back through the same paracentesis, and then, this is shown here, so it's now back, and then we're going to now direct it down this way, catching as much of the iris tissue as close to the pupillary border as possible, and we're going to exit out through this paracentesis. Here, I would hold the needle driver with my right hand. I'm going to head down this way. And so here, now we've caught most of the iris going this way, most of the iris going this way, and we're going to exit out through the paracentesis. Again, we're leaving this guy alone for now. Next, we're going to take the same needle and we're going to direct it this way, exiting out through this paracentesis. Again, for this step, I'll be holding the needle with my right hand, and again, we're going to exit, catching as much of the iris tissue as close to the pupillary border as possible. And then we're going to exit out through the paracentesis. You can see again more and more of the pupil is being captured here with the suture, and now we're exiting out through this paracentesis. Now is the time to use this needle. We're going to go through the same paracentesis. It's very important that you exit and enter through the same paracentesis for all 4 here. And we're going to direct it going downwards and exiting through this paracentesis. So for this step, I'll be using my left hand to go down this direction. And so here, we're going to dock through the paracentesis. We're going to head down, and the needle has gone down, has exited out through the same paracentesis, and now you can see that we've completed 360 degrees. We're not done. You have to now cut each needle off, and then you can pass them back to the nursing staff. And now we're left with 2 suture strands. So you can tie these suture ends in many different ways. There's the classic mechanical suture technique, but there are of course many variations. Once you've tied the knot will enter into the AC, and then you're going to have to trim the suture ends. I use MSD horizontal scissors, and the tension will dictate the diameter of the pupil. And so here's the end product. The pupil has become a lot smaller. Here is the proline, and here I highlighted the knot that has been trimmed. So anyways, this is a basic illustration of the procedure, and I hope you found this to be useful.